Hi, everybody, and welcome to another interview from the Kantara Initiative team. I'm Karen Bright. I work with the Kantara team on communications, and I'm delighted today to have Ryan Howells from Leavitt Partners here to talk with Kay, our executive director, about some of the work they're doing through the Karen Alliance and how we at Kantara Initiative and our members can actually benefit and learn from some of the experiences that they're having. So welcome, Ryan, and thank you very much for making the time to chat. And of course, welcome, Kay. I know you guys are flat out all the time, so it is great to have a little bit of your time just to get your thoughts and help our members understand the direction that we're moving in. So Ryan, to you first. Tell me a bit about yourself. We've not met before. So tell me about Karen Alliance and the role that Leavitt Partners and you particularly play within that.
Sure. Yeah, happy to be here. Thanks for having me. So I live in just outside of Atlanta, Georgia, here in the United States, and have been working in healthcare technology for about 25 years. The Karen Alliance is a group of organizations that have come together voluntarily in a loosely coupled convening that we have convened under Leavitt Partners management to be able to focus on getting individuals, consumers, digital access to their healthcare data, really where, when, and how they want to achieve their goals. At Leavitt Partners itself was started by former Secretary Mike Leavitt when he was Secretary of Health and Human Services under President George Bush. And he has really made it a mission to try to convene multi-sector stakeholders to solve really difficult issues in healthcare. And one of which obviously is getting individuals digital access to their data through the use of APIs and OAuth 2 and OpenID Connect, and finding ways to make that happen. And digital identity is a big part of that.
Okay. And Kay, from your perspective, what are we doing with the Alliance and with Ryan's team particularly?
Well, thank you, Karen, and welcome, Ryan. It really is great to have an opportunity to talk like this. So the Kantara Initiative, as you know, is focused on standards and on accreditation to the NIST standards around identity proofing, authentication, and federation. And we've been really pleased that, to be honest, that Ryan and his colleagues really had the foresight, I think, and the innovation to recognize that if they really wanted to be tackling digital access and digital identity in the healthcare industry, working with healthcare providers, they had to be sure that they were creating systems that were rigorous and that were really based on the standards, so that all of the personal data, all the information exchanges would really be well protected by trying to meet those relatively high NIST standards. And so that's where they really brought Kantara in, and I'm very grateful. And I find that the work that they're doing is very innovative, and yet it's so critical to the healthcare industry. And so that's a small piece that we provide, but I think it's really critical to lay the foundation for that integrity of the whole system.
Yeah, absolutely. So tell me a bit more about the project then, Ryan. It sounds like there's a full kind of program of work around digital identity, and obviously the pandemic will have heightened the need and also the awareness for digital identity in healthcare. So kind of what have you learned, and where's the program at today?
Yeah, so just to Casepoint, just laying the foundation. So back in 2016, just before President Obama left office, the US Congress passed what's called the 21st Century Cures Act. And it was legislation that was primarily focused on new innovations in healthcare. And one of the things that was mentioned in that act for the first time was this use of application programming interfaces. And for anyone in technology, they would say US healthcare didn't talk about APIs until 2016. And well, unfortunately, the answer is yes. And so once that happened, there was subsequent regulation that came out from what's called the Office of National Coordinator, ONC, who oversees provider technology here in the US, and then also the Centers for Medicare and Medicaid Services, or CMS, who oversees health plans in the United States. And so there were two regulations that were written, both for the health plan sector and then for the provider sector, to actually implement these APIs, as well as OAuth 2 and OpenID Connect. And it was the first time that that has happened under a federal mandate in the history of healthcare. So literally since between then and really last year, health plans and providers around the United States have implemented those technologies. Now, in parallel to that, the other thing that has happened is obviously here in the US, the NIST guidelines came out, 863-3, which I know is very well known by the Conterra folks here. And when that came out in the summer of 2017, in the fall of 2017, we were the first groups to actually recognize that it was important to implement 863 in healthcare. And as a result of that, the Office of National Coordinator said, yeah, this IL2 looks really good for individual consumer access in the early part of 2018. And then there was a little bit of a delay for about 3 or 4 years. And then they have started in earnest again, looking at ways where they can implement this. In fact, just as of 2 weeks ago, they've come out with more, what they call standard operating procedures or SOPs for something called the Trusted Exchange Framework and Common Agreement that's being implemented in the US. And as a result of that, they said again, 863 is the right way to go. And IL2 for individuals who want to access their data is the right way to go. And we're pleased to see that because we wrote a white paper back in 2020 explaining how we could do this. But the specifically to answer your question, Karen, that kind of lays the framework for why we're doing what we're doing, is that we saw a need not only for digital identity in healthcare and implementing this IL2 credential, but also the ability for us to be able to federate that credential. We think from a consumer's perspective, there's no reason why a consumer needs to go get identity proof multiple times. If they've been identity proof first, and most importantly, that they have been certified by one of these trust framework organizations like the Conterra Initiative, we think that that is good enough to be able to then say we can use that, a consumer can voluntarily use that credential to go get their data from any provider or health plan in the United States. And that is at the core of what we're trying to do in the proof of concept. Last thing I'll just say on the proof of concept itself is that we've got over 20 organizations participating in it. They include major health plans around the country, major providers that are around the US, credentialing service providers, identity providers, trust framework organizations like the Conterra Initiative, and another one called Direct Trust, who focuses more on the PKI side of things. And most importantly, we have our federal government partners who are participating. So the Department of Health and Human Services has what we call an identity broker service called XMS that allows for these credentialing service providers to be loaded into XMS and then be able to federate that credential using essentially a dropdown, almost like a single sign-on for healthcare, so that could be put on multiple portals around the United States in a way that can help to federate that credential. But really at its core, Karen, and why we're talking today is we want to make this work for everybody. And the way that we make it work for everybody, as Kay talked about, was this idea that we need to make sure that any credential service provider that's been certified by Conterra can participate in this. And the great news, as I mentioned, is 2 weeks ago, the federal government agreed with us and said, yeah, that seems to be the way to go. And so we're now really off and running. We just need to prove it out. How do we actually make this work? How do we leverage trust frameworks in US healthcare to actually make this work at scale?
Cool. Yeah. Well, I guess it's in some ways the pandemic, it did us all a favor in that sense, because it actually started proving to people who perhaps didn't quite understand what digital identity was all about, and especially a federated model, started realizing where the value and the benefits come. So what has been the biggest challenge, do you think, so far in terms of getting providers to come on board with it? Is that proving easier now, or is the challenge still going to be at the consumer level with getting people to understand what this is all about?
I think it's a little of both. I think there's been some challenge in terms, we've been pleasantly surprised, first of all, about the number of providers that have come forward who voluntarily would like to participate in the proof of concept. Some of these are the largest providers in the US, so we're super excited about that. I think the challenge becomes just understanding what digital identity is. It's fairly
Yeah.
new for those who haven't understood it really, and they understand how to authenticate into their own systems, but
Yeah.
person-centric identity is a real new thing. And so what is this? Who's this Conterra initiative? What's this NIST standard? We're still going through the definitions of what that means. And then once we can get through that, then it just becomes a matter of, from a technology perspective, can the systems actually interoperate with each other? But then also from a policy perspective, the big question, Karen, we're trying to answer is, if I'm a relying party, how do I trust a credential that comes from a source where I may not have a business relationship with them? Like, how am I going to trust that is done? And obviously, Conterra as a trust framework provides that trust for us. So it's helping to spotlight the value that Conterra brings to the ecosystem, that they are the foundation of this trust that we're starting to actually build in the healthcare ecosystem.
Yeah, that's a huge point, isn't it? That the kind of inter-organizational trust is as important as it is for consumers to relying parties to providers. So Kay, we've got obviously a raft of different members across different sectors. What do you think are the big sort of learnings, and what are the messages we want to take to members who may not yet be as far advanced as some of the organizations that Ryan's mentioned?
Well, Ryan made a comment about how it's probably hard to believe for those of us who work in digital identity that somehow healthcare hadn't really contemplated this until whatever year, 2016 or whatever, except that I actually think there are multiple industries who actually are already working with digital identity and haven't thought of that as its own special area of expertise, and that they should be focusing on that because that's access to their whole systems. And yet it often gets glossed over. So I think actually it was very insightful that the healthcare industry picked this up. I think it's very insightful to see what Ryan and his group has done in terms of working with the federal government. We have seen at Conterra that federal agencies have looked at this as significant and important. Most federal agencies require those vendors that they have contracts with to have IAL2 and or AAL2 certifications already. But in some ways, it was a very closed group, right? It was a smaller group, and it was focused more on federal practice, if you will, and access through that. What I think is amazing, and I think is really, what do I want to say, life-changing. I mean, in many ways, this opens the door to other industries to realize that this isn't just something that federal contracts are about, right? This is something where you're really providing that access, and you're providing, in many ways, less friction, a better user experience. You're allowing consumers to have better access that is more privacy enhancing for their own data, especially their health data, right? And I think that Ryan's point about, so we're asking people to trust the digital identity credentials and so on provided by an entity that they've not done business with, and which is really the focus of Conterra, right? We're all about trust. And what we have seen here in the US and also in the UK is how significant it is if we are doing these kinds of accreditations so that there is consistency in the field, so people can have that confidence and they understand what that confidence is built on. Why is this foundation something that you can trust? Why is IAL2 and the NIST standards and all, why is that something that if you look for that and you see it, even if you haven't had that business relationship, you can have confidence, you can have trust that the product that you're getting from them, the work, the APIs that they use, whatever, are also based in that same foundation. And there's a consistency and a uniformity that really allows you to build from there. And so I think, but recognizing that, I think is really incredibly astute and innovative of Ryan and his group to really see how that could make a huge difference in what they're trying to accomplish. And I think they're trying to accomplish a real shift. I mean, a seismic shift in
Yeah.
how healthcare providers are approaching this, but so much potential for enhancement for the consumer, for the healthcare providers. I mean, for the plans. I think really it's a win-win.
Mm.
So I can't say enough and sing their praises enough about what they've really recognized and built into this project and this proof of concept around digital identity. It really is sort of life-changing, if you will.
Yeah, and I guess history will tell its own tale, but we'll look back and see this, these were the early adopters. You were the vanguards of this and the pioneers of all of this. What sort of objections or challenges or concerns do you see from organizations when you're trying to kind of talk to them about the program, Ryan? Do you what is that common fear that holds people back from stepping right into and jumping in both feet?
Yeah, so in US healthcare, there's been a regulation that's been in place for a number of years called HIPAA, the Health Insurance Portability and Accountability Act, and it was passed in 1996. And it's the way providers and health plans actually send data back and forth. The challenge is that the consumer is not inside that HIPAA regulated box. They're actually outside that regulated box, and they are actually governed by what's called the Federal Trade Commission here in the US. And Federal Trade Commission, the way that they handle third-party apps is basically really, according to FTC Section 5A, it's whatever's in the terms and conditions we're going to enforce. And so if they say they're selling your data to North Korea, and as long as they do that, then that's fine, right? And obviously that's totally unacceptable in healthcare. So what we've tried to do is to develop a code of conduct. And what the FTC has said, if the industry agrees on a code of conduct for how data should be shared, then we can enforce that. So we'll have federal enforcement and private sector enforcement. So we developed this code. It was actually named in federal regulation as a industry best practice. And it's been implemented everywhere. And so now we've got some protections in that FTC space for this healthcare data. But to your point about what the objections are, if in fact a health plan or a provider in that HIPAA regulated box, if they send this data to a third-party app, even if they go through the digital identity process and it's the wrong person, they still can get fined by what's called the Office of Civil Rights, who enforces the HIPAA data protection laws, and they get fined for that. And so even though that they may say on one side of their mouth, and they believe this, we want to give data and information to the consumer, there is this challenge that we don't know if 100% of the time we can give the right data to Karen Bright. Right. And give it her data, not Ryan Howells' data or Kate Chopard's data. Right. We want to give Karen Bright's data to Karen. And that becomes a challenge in a networked environment because then you're saying, I am who I say I am. I'm proving my identity. I'm requesting my own data. So I'm consenting to provide me the data. But now I want you to go get it from every health plan and provider I've ever had in the last decade. Well, that's hard because I've moved, right? I've changed my demographic information. I may or may not be I may have gotten married, right? Divorced, remarried. Like there's all kinds of things that could have happened in the last 10 years. And so we're trying to find ways where we can understand what does that look like? Historically, in a networked environment, digital identity, and then how do you match that against records that don't have the latest demographic information? It's a huge challenge. But if you're a consumer, or even more importantly, if you're the physician of a consumer who has a chronic disease, you need to have that decade's worth of information to be able to provide the best care to your patient. So it becomes absolutely critical for providers to be able to have this information at their fingertips. And it's just trying to solve that challenge of how you actually aggregate that from multiple disparate systems over the course of a decade.
Yeah, and there's a really interesting point in there is that as we're moving forward, are we looking at the right sort of identifiers? Perhaps people are caught up too much in thinking the old way in which we identified people. But if a physician is looking at somebody who's got a chronic illness and he knows that person within that context, it's almost the illness that's the identifier rather than a specific name or a address, or as you say, multiple names. And I do wonder, are you seeing anything around the actual identifiers that are used in specific use cases changing as the world becomes more digitized and more sort of socially integrated?
Oh yeah, I think we are. I mean, there's always the use case of I only go to the doctor once a year, right? Mm-hmm. And I may be moving every 2 years, right? Because I'm in the military or what. There's all kinds of use cases there, and so we do see those identifiers changing fairly frequently. And and again, that challenge becomes not necessarily proving you are who you say you are today. I think that challenge is pretty straightforward. There's some things to work out there in terms of making sure you have up-to-date demographics, et cetera. But it's more proving that you are who you say you are today, and that is the same person who we're linking records to for a provider you haven't seen in 8 years, right? Like, what does that look like? And that problem of what we call patient matching or user linking, that's a challenge that every industry has. Even in the UK, I know we just talked to somebody the other day. It's just, even though they have these medical record numbers and you've got NHS that's there, they still have an issue across multiple different providers of linking records. It's kind of an inextricable problem.
Absolutely. So Kay, what is the message that we want to take back to our membership about where this is going, and the fact that this is a bit of a leading light in the industry? What are the next steps that we want members to be thinking about?
Well, I'd like to go back to something that Ryan said early on in his last round of comments and explanations, talking about the code of conduct and talking about really private sector organizations adopting these standards, if you will. And I think that is one of the things that also is kind of a shining light, and that is, this isn't just some government mandate. It's really the private sector recognizing that this is beneficial to them, that it is significant to be able to implement and to use these standards, to adopt them, and then to really make sure that their systems are built on those standards, and recognition in the private sector that this helps us. It helps everyone. It helps the consumer. It helps the relying parties. It helps the service providers, and it puts us on much better footing. And I think that, as I mentioned before, I think there are multiple industries that could benefit from having that view. And unfortunately, not many do. The financial industry maybe is the closest, and they've kind of done their own thing in some ways. But really, I know I keep saying this, but I think the healthcare industry has just been so insightful to go this direction. And I'm hoping that from this model, there'll be lessons learned for other industries, and that we can begin to widen that net. Because I think in the long run, both the public as in the users of the systems, as well as the organizations providing services, whatever role they have in that, everyone benefits. And because it is a win-win. And I really hope that for Kantara, we can continue to improve our systems, improve our accreditation. There's already been things that I have learned from working with Ryan, places that we need to shore up, and we've made changes, and we'll continue to do that, so that we're responsive and helpful, and making sure that that consistency and that foundation is really there. And I hope for our Kantara members, they can begin to see that there are a lot of use cases out there where we probably haven't always been as innovative to think about, wow, this really applies, and we should be doing more. So I would encourage our members to join some of these work groups that we already have in place. And if they have ideas, if this spawns interest and thoughts about, gosh, there's a different area that I work in, we could be doing this, let me know. We would love to start up other work groups that are focused on taking this into the industry that really can make a difference for everyone and enhance digital identity across a very broad spectrum. So I think that that's critical. And like I said, I think it's life-changing. So I hope that they'll get involved if they have not already. And and anything they can do. I mean, anything that we can do to support Ryan's work, I think we want to try to do, because it really is incredible. And we're just so pleased to be a part of it.
Okay, well, final question to both of you then. A little bit of crystal ball gazing and horizon scanning. What do you think is the next big disruption that will affect the digital identity sector? Where is it going to come from, whether that's a sector or an innovation in technology? Ryan, what are you seeing from your perspective?
Well, I think, that again, the credentialing service provider industry is still emerging, right? You still have different groups and different entities that are still producing solutions. Many of them are younger companies. Some of them are a little bit more mature, but they're still kind of evolving on their, and the guidelines are changing too, right? NIST is going to come out with version 4 here soon. And so we'll see, I guess, how that changes as well. I would say that in that emerging sector, though, I'll talk specifically around US healthcare and how identity is going to affect that. We think that we're going to actually move to a model probably within the next 5 years in healthcare where we're going to be, the basis of our data exchange is going to be API related. And that's a huge thing. We use a little bit more antiquated technologies today. But if it's API related with OpenID Connect and then OAuth 2, and this idea of really a federated identity model, it changes really everything, because what that does is it allows us to not compete on whether we have the data or not, because everyone's really going to have it. They're going to know who they are. They're going to know what authority they have and authorization they've got to get the data. They're going to be able to be sent the data. Now we can do really exciting things that we've wanted to do for quite some time, which is, if someone has a chronic condition and they've had it for 10 years, to have really smart physicians be able to then say and use technology as an accompaniment to say, how do we actually really help to make this keep this person healthy, and find ways where that can happen at scale, and use AI and machine learning to help normalize the data and figure out ways where we can get the real insights we need to help them. And that is obviously our main goal. That's what we want to try to have achieved. We want individual patients to take an active role in their own healthcare and find ways where they can engage directly with their physicians. Consumerism is a big topic in US healthcare. It has been for quite some time. There's nothing like digital identity to actually instill consumerism in healthcare. So we're super excited to see what occurs and what happens, but we're modernizing the whole US healthcare data ecosystem. That's going to take some time, right? And then after we're kind of through with a lot of that work, then we get to really see the fruits of our labors and see how this is actually going to really make a meaningful difference for both providers and for patients.
Karen, you're on mute.
Sorry, I think you're absolutely right. It's the start of a journey, but it does feel like through some of the work that you're leading on that there is a sense of momentum. And certainly over here in Europe, I'm very excited to see what develops out of the Karen Alliance and the healthcare projects particularly, and what we can potentially adopt over here as well. Same question to you, Kay, then. What's the prognosis for where we might be in the next 3 to 5 years, and where the next big trends are going to come from?
Well, I think what we're seeing starting now, and we're trying to get our arms around it, is really issues around equity. And some of that has been spurred by controversy around facial recognition and other things. And we know that equity is something that NIST is also grappling with as they're coming out with version 4, as Ryan mentioned. But we're also seeing this become an issue to the industry. And some of it is, so let me back up for a second. So the Kantara Initiative has a diversity, equity, inclusion initiative itself that is being led by the board of directors. And we've put a survey out asking companies to talk to us about what are they looking at, what are they considering, are they spending money on this, are they trying to do something different in their credential service provision around the equity issue, and making sure that everyone has access somehow. and that it's fairly provided across all different kinds of diverse factors. But I think that is an area that we're going to continue to see discussions and developments, and we're looking at the marketplace and what's the business case for this. And I think in industries like healthcare, where the goal is not just to provide services to a certain slice of the population, it has to be available to everyone. So those are challenges that I think we have to figure out, how do we do that? I think in the past, perhaps some service providers or for some federal agencies were able to really just focus on sort of the middle. And now we need to look at the outliers on other ends. We need to bring that equity to bear for everyone, so that digital identity is not something for just a certain segment, right? Or that at the same time that we're providing digital identity opportunities, we're also not subjecting people to more fraud risk, to identity theft, to other kinds of issues. So trying to find that balance, I think, is a challenge going forward that we're really starting to define and figure out where we go from here. And I hope, Kantara wants to try to provide some leadership in that, especially in terms of the service providers, and also working with relying parties to figure out, how do we get our arms around this, and what do we need to solve for? And we see that happening in a variety of ways, but I think that's one of the challenges that we're going to be facing in the next 3 to 5 years as well.
Great. I think the healthcare sector can lead us very, very much on that space as well, because clearly, health services are going to be something that's at the forefront of everyone's minds, really. For me, thank you both very much. I appreciate you giving up the time to come and talk to me and to share with everybody. If there's anything else that you think that I've forgotten to ask, or you want to add in, now's the chance. Anything from you, Ryan, or you, Kate?
I was just going to say that everything that we do in the Caring Alliance becomes public on our website. So if you want to know more information about what we're doing, you can go to Caring Alliance, CARIN, carinalliance.com. And there's a digital identity section there that shows a lot of what we're doing in the proof of concept. And then we're going to write up our findings with Case Help and others in terms of lessons learned. What did we learn from this, right? Like, what progress did we make? What gaps do we still have? And that's going to be written up later this year on our website. Brilliant. So happy to share that with other industries, as Kay mentioned.
Oh, that'd be great. And at the end of this presentation and this video, there'll be details of where to find all of that information, both on the Kantara Initiative site and at the Caring Alliance site. So that'll come up shortly. Kay, anything finally from you before we log off for the day?
Just that we are so pleased to be working with Ryan and with the Caring Alliance on this project. And I would encourage, if you aren't a member of Kantara, to consider joining, and also to get involved. I think there are a lot of exciting things happening now, and it's a wonderful opportunity. And I think this is a good example of really some innovative and exciting work that's happening in the field. And I would love to see us continue to progress this and to expand to other industries. So we want to make our tent very large. So please come and join us.
It certainly feels like it's a great time to be in the digital identity industry, doesn't it? Yeah.
It does.
Okay, thanks, guys. I appreciate your time, as I say, and all the follow-up information will appear shortly on the screen. And I'm no doubt at all we'll be speaking to you perhaps towards the back end of the year when that report comes out, Ryan. Thank you.
Thank you.